After you get your braces on, you are going to receive this bag. It contains a soft bristle toothbrush, wax, a Proxa brush, floss threaders, a prescription of fluoride, and what foods to avoid. Some foods to avoid would be anything hard, brittle like peanuts, or chewy, sticky stuff like Laffy Taffies, Starburst, or caramel. Please don't have anything in your mouth that isn't food. You can still chew gum as long as it is sugar-free. We are giving you a prescription for a special toothpaste that has a booster amount of fluoride. Think of it like a vitamin for your teeth. Here's how you will use this. 2 nights a week, you pick, after you have brushed your teeth with your regular toothpaste, you will put a pea-sized dot of the fluoride on your toothbrush and brush it all over your teeth. You can spit it out, but don't rinse your mouth with water. We would like it to sit on your teeth all night long. There is a soft bristle toothbrush in the bag that will help keep your teeth clean with braces. There isn't anything special about this one, so when it wears down in a few months, replace it with another one you find at the store. If you have an electric toothbrush, that's great. You don't have to have one, but you can use it with braces. It is important to brush at least twice a day. You will need to get all of the food off of your teeth because if not, scars will form on the teeth. When brushing your teeth, there are 3 different angles that are important. Make sure you get on top of your brackets, below your brackets, and above your brackets. Circle motions help to catch and remove the most stuff. Dr. A recommends that you brush for at least 2 minutes each time you brush. If we see you aren't doing an amazing job, we'll up that time. After brushing your teeth, please take a minute to look in the mirror and see if things look spotless. If not, take your brush and hit those areas again with no toothpaste. Then rinse your mouth and check again. Unfortunately, we just made flossing more difficult for you. There is definitely a way you can still floss, and it's with this threader. It will take more time, but can be done. I will say that we've seen a ton of our patients choose to not do the flossing, and Dr. A supports that if they will use a water pick instead. The brand of these does not matter, but it will help get things even more squeaky clean. Here is a package of floss threaders that can be reused. You will drape the floss through the threader. Don't tie it because you can reuse these, and push the threader under the wire. Put all of the way through until it is just the floss, and then you can floss like normal underneath the wire. If you don't thread it under the wire will prevent you from flossing all the way between the teeth. This is a Proxa brush. After you eat, this tool will help you get the food that is stuck in between the brackets when you are unable to brush. This is easy to carry around with you for those times that you can't get into a bathroom to brush, but you have something stuck between the braces that your tongue can't get out. Stick it in your backpack or your purse. Wax is going to help if the brackets are rubbing your cheek or a wire is poking you. You will take as much wax as you need and rub it in between your fingers until it is warm and moldable. It is better if you can make sure the area you are sticking the wax to is dry. Do this by sucking your spit and swallowing it. Once the area is dryish, then mold the wax on the area that is bothering you. It will come off when you eat or brush, so you can take it off before you eat, but if you do swallow it, it's not a big deal. Typically, you will use this only in the beginning or if you get a sore in your mouth. Sometimes sleeping on one side and the bracket digs in, or you get bumped in the mouth by your dog or something like that. It shouldn't be a thing you deal with very often. If you start experiencing discomfort, such as something poking, text us a picture of the problem area using our office phone number. Many times we can help identify what is going on and help save you an extra trip to our office. Any emergency or bracket that comes off will rarely, if ever, make you wear your braces longer. Unless your next appointment is to remove the braces, we will make sure things are comfortable and make plans to replace any missing brackets at the next regular visit and not make you come in for an extra visit.